Hello and welcome to this podcast brought to you by the Isle of Man Anti-Cancer Association. My name is Malcolm. I am a retired consultant surgeon and throughout my career I had a particular interest in the care and treatment of cancer patients. Presently I am chairman of the Isle of Man Anti-Cancer Association.
And I'm Sandy, Executive Officer of the Isle of Man Anti-Cancer Association and a cancer survivor. In this podcast, we want to provide a few tips for those who may be considering changing to a healthier lifestyle. Many of us have acquired habits in our lifetime, whether simply through our upbringing or wanting to try things out for ourselves, or possibly succumbing to peer pressure and avoiding being excluded from the club, as it were, or even as a result of promotion of products across a range of the media. There is certainly a lot of pressure on individuals to comply with many of the excesses readily available in our society in the developed world. Sometimes you might feel that you would like to change certain things that you have got into the habit of doing and try to avoid some of their consequences, such as increased heart disease and cancer.
Such thoughts often follow the premature loss of someone whom you might have identified as being the life and soul of the party, but who may not have been as attentive to their health as they thought they ought to have been. On the other hand, it may simply be a new year and you're looking to make a new start. Giving up smoking, losing weight and getting fit, and drinking less alcohol are things that come to mind. They are certainly important considerations that we know can improve your health and well-being and reduce your chances of developing cancer.
So recognising that you want to change things and setting about doing something is a challenge. Striving to maintain it with all the distractions of work, family and home often make things appear impossible. It's important not to set unattainable goals for yourself at the outset. Set small targets instead. So reduce your chocolate intake, for instance, cigarettes or alcohol in increments over weeks or months, and give yourself some reward when you reach a target, a pamper day or a trip to watch your favourite football team play. Stick at it. After a few weeks, many will experience a reduction in craving. Join with someone else so that you can support each other or use the available support services. Make a permanent positive lifestyle choice to make a long-term improvement to your health.
Giving something up can be hard though, but it does not always have to be about giving something up. Why not focus on the positive things you can do instead? For instance, you can reduce your cancer risk and improve your overall health by adding foods that are high in fibre to your diet. Cancer Research UK tell us that we can reduce the risk of developing cancer by eating 5 portions of fruit and veg per day and incorporating fibre-rich foods in our diet. Things such as whole grain cereals, whole grain bread, brown rice, etc. Start by making a small change, for example by choosing the whole grain bread option or maybe changing the sweetie snack to some dried fruit.
There are other things you might consider. If changing your diet is not for you, then getting more active is another positive way of adding something to improve your lifestyle. Cancer Research UK recommend that we try to include 2.5 hours of moderate activity every week. It doesn't mean you have to join the gym if that's not your thing. Moderate activity is any exercise that gets you warm and slightly out of breath. Gardening, walking or even housework can all count towards it. So take the stairs rather than lift at work. On a fair day, leave your car at home and walk instead. Do this once or twice a week. And walk with some friends of an evening a couple of times a week. Keeping active will also help you to maintain a healthy weight, make you feel better in yourself, and it has great benefits for health and overall well-being.
There are also a number of very simple actions that we can take that can also reduce our risk of dying from cancer. For example, take part in screening. If you've been invited, please use the opportunity. Don't just ignore it. Screening is a fantastic way of seeing if there are any problems before any symptoms will otherwise be noticeable. Resolve to make a cervical screening appointment. Complete and return your bowel screening pack, or attend the appointment for your screening mammogram. These all cost you nothing and can be a lifesaver. Another simple tip is to put a note in your diary or on your mobile as a regular reminder to check your body. The human body is a complex machine made up of hundreds of different parts and doing many different things. Each individual knows their own body better than anyone else and are usually the first to be aware of anything that does not seem quite right, such as tiredness, not so keen on eating, or clothes not fitting quite right. Little things over a few weeks that could indicate that something may be awry. Get to know what is right for you and take notice of any changes, and most importantly, talk to your doctor if you have any concerns.
If you're worried about something, talk to your doctor. If something is bothering you, please don't just ignore it. Get it checked out. So where can you get more information? Well, as usual, there are plenty of places to find out more about what we've talked about. A good place to start is the Macmillan Cancer Information Centre up at Nobles Hospital. You can call them on 650735. You can also visit the Cancer Research UK website, which is cancerresearchuk.org, and of course our website for more guidance too, on iomaca.org.im. Also, if you'd like to give up smoking, the Isle of Man Quit For You service offers expert advice. You can contact them on 642 404 or email them at quit@gov.im. Thank you so much for listening.